Turning now to more developing news as the FDA has authorized Pfizer's booster shots for children ages 12 to 15.
The Western Mass News reporter Lexi Oliver joins us in studio with more on what that means in the fight against the pandemic. Lexi.
Yeah, Chris and Jordan, younger teens who receive their first set of vaccines from Pfizer, Moderna, or Johnson & Johnson may get Pfizer's booster shot. And one doctor I spoke with says this is an important step as the Omicron variant continues to surge in Western Mass.
A big day Monday as kids 12 and up are one step closer to receiving their third COVID-19 shot. The FDA expanding its emergency use authorization of the Pfizer booster shot to include that age group, but the CDC still must sign off on the authorization. Dr. John Kelly of Redwood Pediatrics expects it to be approved by the middle of this week, and he tells Western Mass News they're already starting to see a demand for this age group.
We actually had one child this morning. The mother asked if their 14-year-old could get a booster shot.
Dr. Kelly says the added protection against COVID-19 is important, and he does not see a downside to getting the booster.
I think it's anytime we have a chance to decrease the amount of or morbidity or how sick people get, we got to do it. We do know that people that even with people with booster can get the variant Omicron, but we know that almost guaranteed that they're not going to be hospitalized or need to go to the intensive care unit.
His office, however, does not vaccinate this age group.
We actually don't have a supply of the 12 to 15-year-old vaccine because the shelf life of it in our fridge is only 30 days, so that it wouldn't work well for us.
He says those 12 and older can get boosted at their local pharmacy. One Springfield parent tells us she thinks parents should weigh the pros and cons of getting boosted and have a conversation with their child.
I feel like if they did well with the shots, then give them the booster. If they haven't had their shots, I think it's something to think about.
Dr. Kelly is also pleading with residents not to seek testing in the emergency room, saying they're overwhelmed and need to have capacity to take care of people who really need to be there. He does say their office does rapid testings. For that, you need to make an appointment, and then you can drive up and a nurse will swab you at the car. Live in studio, Lexi Oliver, Western Mass News.